Good afternoon, everyone. So, just to begin with, the office staff has already told me that they're going to be praying for me because I should be, I shouldn't be making videos that I might be held responsible for later on. But oh well. And I think Betty is saying a few Hail Marys in the background for me. Anyway, I want to share another example of the ridiculousness in healthcare that I just got done experiencing. So, sometime last week, I initiated a prior authorization request for a patient's medication, which come to find out the insurance company to which they pay a crap load of money to doesn't have her in the database. So I contacted the patient back, and they apparently were issued a new identification number, which I then resubmitted to the insurance company, who still doesn't have them in their database um, for whatever reason. So I called the patient back and got a different number for the prior authorization department. Now, it's important to keep in mind that the patient's husband works for the very same company that I am calling to. So it's kind of interesting. Regardless, I got a very nice lady who informed me that my request, my prescription, my medical treatment, that is really a continuous treatment or a continuity of treatment, has to be reviewed by their clinical department. Now, to the best of my knowledge, no one in that clinical department has actually examined the patient. They've not taken a history, reviewed charts, examined the patient, and determined the most applicable treatment. But nonetheless, these nameless bean counter ding-dongs in the back room are going to review my request to see if it's clinically appropriate in their terms. So I asked the representative what I should tell the patient to do. And their response was that the patient can certainly pay out of pocket for their medications, and if it's approved, they can try to seek reimbursement. However, the reimbursement may not be 100%. So this young lady and her husband are paying a crap load of money for pretty pathetic insurance from a company that her husband works for. How much sense does that make? Pretty much none. So I'm going to let Betty and Kim finish up their Hail Marys and their Apostles' Creed and the Nicene Creeds and all this sort of stuff for me, because I'll probably burn in hell and I'll probably be in jail by the weekend. But anyway, I thought at least you folks would get a kick out of this in the meantime. Have a great afternoon.